your, and if you just, you'll have to accept that in order to remove it from your screen. And I think we're ready to go, Gary.
All right. Well, hello, everyone. I'm Gary Gonser, the president of ESCOM. I want to welcome you to our Spotlight Presents program on effective communication strategies with the Alzheimer's Association. Now, our speaker will be Ariana Myers from the association. Our host today, I'm honored to say, is Joanne Wadinsky. All right, here is Joanne. Thank you.
Good morning. I am Joanne Wadinsky, and I live in Marin, and I am an ESCOM member with a deep relationship with the Alzheimer's Association. About 25 years ago, my in-laws were visiting from Ohio, and when they left, I turned to my husband and I said, "Something is really wrong with your mom. I don't know what it is, and your dad is going to cover for it for as long as he can." And I was right. She was diagnosed with Alzheimer's disease, and so we started the trek down that long road with her. And many of you may be faced with this devastating disease or have unanswered questions about Alzheimer's. Our guest speaker today can clear up some of those issues about communicating in daily life with Alzheimer's disease. Ariana Myers is a volunteer community educator and public policy advocate with the Alzheimer's Association. She has worked in Marin County on various aspects of Alzheimer's disease over the last 10 years, including running her own home care health agency with senior care emphasis. She's a certified Red Cross nursing aide. She worked in research at the Buck Institute for Research on Aging, and most importantly, is the mom to 6-year-old Haley, a happy and adorable first grade girl. Ariana is passionate about her service with the Alzheimer's Association and shares our visions of a world without Alzheimer's and other dementias. I know many of you will have questions for Ariana. Please put your questions into the chat box and we will address as many questions as we have time for at the end of the presentation. Please make note, the Alzheimer's Association website, alz.org, and the 800 number, 800-272-3900, is available 24/7. The association is here to serve the community and understands your concerns and issues with this sad disease. So now, without further ado, may I present the lovely Ariana Myers.
Thank you so much, Joanne. And hello, everyone. I'm going to start by sharing my screen. And hopefully that works for, hopefully everyone can see that. So good morning. Welcome to the Effective Communication Strategies program sponsored by the Alzheimer's Association. So today we're going to explore how communication takes place when someone is living with any form of dementia, including Alzheimer's disease. By the end of today's program, you'll be able to, as you see here, explain the communication changes that take place throughout the course of the disease, decode some of the verbal and behavioral messages being delivered by someone who's living with the disease, and respond in ways that we hope are helpful to that person. And then ideally help you learn to identify strategies that are going to help you connect and communicate with that person at any stage of the disease. Okay, so we're going to start by, before we get started, just really address what is communication. Communication is more than just talking and listening. It's really about sending and receiving messages, and you can do that through your attitude, your tone of voice, your facial expressions, your body language. And when you think of it that way, then communication is really a way to express who we are and how we relate to each other. So as the brain changes in a situation like someone with Alzheimer's disease or some other dementia-related progression, people lose their ability to speak and decode language in the usual sense. So the better we understand the changes that they're undergoing, the better we can connect with people living with Alzheimer's or other dementias throughout the course of the disease. So we really think of Alzheimer's disease as in 3 broad stages: the early or mild stage, the middle or moderate stage, and the later severe stage. And there's not a huge, like a clear break between each stage, but they are substantially different from each other qualitatively in the way that someone who's living with the disease learns to communicate. So as we mentioned, as Alzheimer's disease or other dementias progress, people lose their ability to communicate their thoughts and feelings through words. They lose the ability to understand the words that others speak to them, but they do maintain a sense of self throughout all stages of the disease. So that means that the elements and the characteristics that make that person who they are remain a part of them throughout the disease. So connecting with that person's self is really the key to effective communication, staying connected and giving that person a voice, even as the disease progresses and takes their verbal ability away. So in the early stage, there may be only a few barely noticeable changes. You may not even recognize changes per se in that person's ability to speak. What's really important in this early stage of the disease is to ask that person how they would be like to be helped in later stages of the disease. So while they still have a chance to express their desires, how they want to be treated, this is what's really important to focus on in the early stage. And then, of course, the language abilities diminish as the disease progresses. In the middle stage of the disease, there's a more heavy reliance on, say, behaviors rather than words to communicate and express desires. And then in the late stage of the disease, there's really not much verbal communication at all. And you're really more relying on the 5 senses to connect with that person. So as a care partner or caregiver, it's going to be up to you to change the way that you communicate with the person who has the disease. Remember that the essence of that person always continues throughout. Respect them as the adult that they are, and adjust your communication based on what is meaningful to that person today, no matter what stage of the disease they're in. So now we're going to talk about each of the different stages and kind of how they differ. So starting in the early or mild stage, as I mentioned previously, you may or may not see changes in the way that that person communicates with words. There may be a shift, you can say, in the ease with which they find words. Some of the more common changes that you may see are some of the ones listed here. So difficulty finding the right words, which can result in taking longer to speak or respond to a question, which can also lead to some people really withdrawing from conversations because they're not really able to keep up with the pace of the conversation that's taking place. Some other changes are in kind of executive function. So people may struggle with more complex tasks like decision making or problem solving. And some other things you may see, some people may react more emotionally than they had in the past. Some maybe even wanting to avoid conversations about the disease. But whether or not you notice changes in the way that the person is speaking or communicating, communication in this early stage is really crucial. This is the time when everyone involved, both the loved ones and the person who has the diagnosis, are adjusting, and they're having thoughts and feelings about the changes that are ahead of them. So for some people, denial is kind of part of the response process. For others, they feel it really strongly. The emotions can feel overwhelming. Whatever the situation, it's important for everyone to come to terms with the diagnosis and begin to address the feelings by talking about it and expressing your connection with each other. That's going to help you both accept the diagnosis and move forward and try to discover ways together to live positive, fulfilling lives. So again, communicating throughout this process is going to bring the closeness that's going to help everyone adjust more easily as the disease progresses. Okay, in our first video, Martha Tierney from the Alzheimer's Association home office is going to tell us about how to be helpful in the early stage.
Communicating in the early stages of dementia with the person with the disease is important. At that time, you still have language as a tool, so you can learn things about what they might prefer as the disease progresses. For example, as the disease progresses, a person might have difficulty finding words. Caregivers often struggle to know what to do in that moment. Early on in the disease, you can ask. You can say, if you ever have trouble coming up with a word, would you rather that I jump in and give you the word, or do you want me to wait and allow you some time so you can find it on your own?
Okay, so as Martha stated in her video, one of the best ways to be sure that you're offering help with communication that the person needs is to ask directly. So, for example, if a person's struggling to find the right word, ask whether it feels better to them for you to supply the word, or if they would like you to instead wait while they can continue to try to find the word themselves. It can help as well in the way that you communicate with them. So keep your sentences direct and straightforward to help them avoid feeling lost in a conversation. A shorter sentence can make a meaning more clear than a longer, complex sentence. And similarly, avoid long explanations about whatever's going on, and take your cue from the person. Be very careful not to talk down to him or her. Remember, this is an adult with that sense of self that we want to respect and that they will maintain throughout the course of the disease. And it may take that person longer to find words or put thoughts together and express them. So a really good idea is to just get in the habit of allowing more time for conversations in general than you would have prior to a dementia diagnosis. That's going to help people not feel pressured or rushed. So as well, keep in mind that that person's conversational needs are going to change over time. In the early stage, this is the time when it's very important for that person to have his or her voice heard. And you can help facilitate this when you meet that person right where they are today, regardless of the stage of the disease. Be sure to include the person with the diagnosis in any conversation that they want to be included in, especially crucially if it's going to have an effect about their future. So if you're discussing future care plans, etc., you want to include them in that conversation. Including them can be empowering and engaging for them, and can help establish the connection that will carry you through the later stages of the disease. Some other things to keep in mind: don't make assumptions about a person's ability to communicate just because you know they have an Alzheimer's diagnosis. The disease affects everyone differently, and it also changes over time. So speak directly to the person if you want to know how they're doing. Again, this is part of respecting who they are as an adult. And you can explore which method of communication is most comfortable for that person. If you're trying to communicate long distance, there may be a preference on their part. They may be uncomfortable with say, a video conference, or they may prefer that to just simply speaking on the phone, or perhaps they would prefer to communicate in writing, sending email or handwritten letters where they have the time they're able to take the time to construct the way they want to phrase things. In any case, it's going to be down to the individual, the way that they prefer to communicate. And it's okay to laugh. Humor can lighten the mood. It can make communication easier. It feels a little strange, but if you can include lightness in how you're dealing with things, it can often ease what could otherwise be a difficult conversation. Whatever happens, be honest and frank about your feelings. don't pull away. Your friendship and support are really important right now. And again, we can't really emphasize this enough, whether the person is in denial or whether the person is feeling overwhelmed. The more you talk about it, the more everyone is going to be able to take on the diagnosis and deal with it more effectively. Okay, so that was the communication in the early stage. If you have questions, please feel free to put them in the chat. We are going to take the questions at the end of the presentation. But for now, I'm going to move on to the middle stage. And as I said before, there's not going to be one day where you cross from the early stage to the middle stage, but we do talk about substantially different aspects of communication during the middle stage versus the early stage. So if you noticed changes in the early stage with the person's ability to communicate, they're likely to become more pronounced in the middle stage. There'll be increased difficulty finding the right words. This can result in falling back and using familiar words repeatedly. This is one of the most common kind of communication behaviors that you'll see in Alzheimer's or other dementias. If you can't find the right words, sometimes you'll try to invent a new word to describe what it is you're talking about. So if you can't remember the word for wristwatch, maybe you'll say hand clock, or you'll hear somebody with dementia say hand clock. The person may easily lose their train of thought. They may, again, as we mentioned before, all of the difficulty in speaking may result in someone speaking less often. And again, as a big overarching picture, moving away from relying on words to communicate and starting to communicate more through behavior in this middle stage of the disease. Other things that you may notice, difficulty organizing words logically, reverting to speaking in a native language. And one of the elements about the nature of the memory loss in Alzheimer's particularly is that the short-term memory is what's lost first. And there's almost like a backward progression. Memories that are more recent get lost first, and the memories from early in life stay the longest. So this is why we sometimes see people reverting to a native language, maybe that they haven't spoken in decades, but it was something from their childhood that stays strongly in their memory. Other things like using curse words. So sometimes the frontal lobe, the ability to sort of control behavior can be affected, and you may see someone saying things that they would never have said prior to developing the disease. Also a reliance on gestures, which I do already, but again, if words are harder to find, then gestures may become more important in terms of trying to provide emphasis or otherwise communicate. So those are just some other things to think about. Changes in the brain do make tracking and decoding words more difficult for the person with the disease. And that's why you start to see the behavior as people relying more on behavior as a form of communication. We're going to talk a little bit on the next page, on the following slides, about adjustments that you can make to help you continue connecting with a person who has Alzheimer's or another dementia, even as they're starting to lose their ability to communicate through words. Before we move on, though, we do want to note that there are some physical conditions or medications that can affect a person's ability to communicate. And it's important to understand that you may be seeing a change in communication that is not coming from the disease, but is coming from another source. And the way to really think about that is that Alzheimer's, progressive dementias tend to be very gradual in the changes that you see in a person's ability to communicate. If there's a sudden change overnight, somebody seems much more confused, they're much less able to communicate using words versus yesterday, you may be looking at some other condition causing this kind of delirium. And typically, a urinary tract infection is a very common reason for someone to suddenly be more confused than they were yesterday. And people with Alzheimer's are prone to urinary tract infections. So if you do see a sudden change, keep that in mind. You may be looking at a urinary tract infection. There may be some change in medication that has caused a change in that person's ability. Whatever it is, if this was a more sudden change, plan to take the person to the physician and see if you can determine the cause, because it may be something that's reversible for the time being. Okay, in our next video, Beverly shares advice she gives to caregivers as a support group facilitator.
I would advise couples, and I usually do advise the caregiver who comes to the group and is caring for a spouse, that you take your time. Always count to 3 before you respond, because it gives you time to think about your answer and what's going on. Generally, in a marital dispute, it's quick. It's back and forth. You're quick to give an answer. When they've been diagnosed, to sit back and say, okay, you're supposed to be the one that's reasonable here. Let's change how we do this, because there's only one thing you can control, and that's you. You cannot control them and their process.
So this is great advice from Beverly. I think I had mentioned before that a good habit to get in when you learn about someone's diagnosis is to start to plan more time for conversations, or for really any activity might take longer than it previously did. Another good habit to get in is to, as Beverly mentions, sort of give yourself that 1, 2, 3 before you walk into a situation. Try to ground yourself. It's one of those things that's very easy to say and very hard to do, but make no mistake, caregiving is, you know, it takes a lot of energy. It can be draining, and it's important though, especially when you're relying on communicating not necessarily through the content of the words, but more through your body language, your attitude, and making an emotional connection. It's really important to try and ground yourself and try and be in a good, positive place before you go and interact with the person who has dementia. So when you do go to approach someone, approach them gently. Identify yourself by name and approach them from the front. And there's a good reason for approaching from the front. One of the effects as Alzheimer's or other dementias progress, there can be a loss of peripheral vision, or an ability to interpret what's happening in the periphery. So if you're coming from the back or from the side, you may risk surprising the person. They haven't been able to understand that you're coming to them. You may get a reaction that you don't want. If you come from the front, you have a much better chance of the person recognizing that you are approaching them, and you introduce yourself by name. So, hi, Mom, it's me, Ariana. I'm coming to talk to you and find out what's happening right now, and maintain eye contact. Try to get at the same level with them as you can as well. If they're sitting down and you're standing up, it can feel intimidating to have a person who's towering over you walking toward you. And you know, you can use touch to help establish communication. Maybe take them by the hand and help make that connection so that it's understood what's happening. And that's also going to show that you care and help maintain that emotional contact. Try to avoid criticizing. Don't correct. Don't impose your perspective on the situation. If they're saying something that you know isn't true, it's going to backfire if you're trying to convince someone that something's happening and that's simply not the way that they see it. So as well, pay attention to your facial expression, your tone of voice, be calm. The person's going to be able to either feel your tension or feel your patient understanding with them. And very often they will reflect that back to you. And then again, as we mentioned before, remember to take the time to communicate. Give yourself and the person you're talking with enough time to respond, interact, and connect. And that's when you're going to have the best chance of an effective interaction. Okay, in our next video, Rebecca is going to talk about adjusting her own thoughts and responses when her mother repeated herself.
She could sense my frustration because occasionally I would lose my patience and I would bark at her. Why are you asking me that question again? I just answered that question 2 minutes ago. And then she would get frustrated because, you know, she was very old school and she's like, don't disrespect me. And I didn't ask you that question 2 minutes ago. It's a new question. So phase 2 of our relationship was like, okay, that's a new question. I'll answer it again.
So we mentioned this before. It's really the short-term memory that goes first. And when someone is asking you to repeat yourself or is engaging in a conversation that just took place, the same conversation took place 2 minutes ago, no one's doing that to irritate anyone. It's a reflection of the course of the disease. Repetition is the most common communication behavior that we see in Alzheimer's. And again, it's easy to say, it's hard to do, but it can be very draining and wearying to say the same thing over and over again. So it helps, again, to be in that habit of having, your mantra, your 1, 2, 3 that helps you ground yourself before you go in and engage in communication with the person who has the diagnosis. And we talk about joining a person's reality as a way to connect with them. When you are joining their reality, what you're doing is taking a little bit of time to try to see the world as he or she may be seeing it at that moment. And what we find is that when you do try to see things from that person's perspective, their behavior can become more understandable to you. Due to the changes that are taking place in the brain of the person with the disease, they're probably not going to be able to see your perspective. They may not be able to explain to you exactly what they're seeing, but it's really going to be you who needs to try and adjust and respond to see and try to see the world through their eyes. And you can do that by trying to use respect, empathy, and connection. When you join their reality, that is the key to helping that person have their say, and it provides soothing reassurance to them in a situation. So we have some steps that can help you join their reality as described on this page. Pay attention to both the words and the behavior that they're showing. Keep in mind that they may be saying something deeper about their feelings than the actual words that they're using. So, for example, if someone says, I can drive just fine, there may well be a deeper feeling about that says, I don't want to give up my independence. Please don't take that away from me. Stop taking over my life. I hate it. Can be an expression of something deeper, like I hate this disease. I don't understand why I can't do what I always used to be able to. And if you can let that person know that you understand what they may be feeling and why, then that's going to help you connect with that person. Try to answer any question or issue that they bring up. When you do, be brief and to the point. And then once you've answered the content of the question, try to respond to the emotion behind the behavior. So if the person is communicating with words, you can ask them questions. You can say, you seem sad. Do you feel sad? And then wait for a response. And if they say yes, you can try to guess the cause. Like, do you miss the way things used to be? If the person says yes, then you can say, I do too. And then you've made an emotional connection. If the person is communicating more through behavior, then you really want to try and figure out what might be the underlying cause and see if you can make a change to whatever the situation is. If a person is rummaging through their possessions, that can be communicating any number of things, maybe boredom, maybe they actually need something. Hitting can mean a lot of different things. That may mean the person is physically uncomfortable, too hot, too cold, or maybe you're trying to take a bath, they're uncomfortable being naked, they feel like things are out of their control. And once you've responded to the emotions that are behind behavior, then you want to try and reassure and redirect that person's energy towards something more positive. So you can say, I'm glad to be with you here today. Let's go for a walk. But in this way, you're gradually moving the person from feeling sad to doing something that's going to help lift their spirits. This was a lot of information in one little slide. And if you are a caregiver for somebody in the middle stage of the disease, or if you want to prepare for that situation, we do have a presentation called Understanding and Responding to Dementia-Related Behavior that is put on by the Alzheimer's Association, similarly to this one, that really focuses on those behaviors that you see in the middle stage and helps give you a framework for how to address the behaviors. Like it or not, when you do encounter a certain behavior, you're very often likely to encounter it again. So it can help to have a framework or a method for responding when someone has a particular kind of behavior in the middle stage. Again, it's important to try and make that connection. Just reiterating what we'd said before, keep it slow, keep it basic, take your time, be patient. The more you slow down, the less resistance you're going to encounter, because the person isn't going to feel that pressure of being rushed and unable to keep pace. And if you use the short sentences and basic words, then you have a better chance of your actual vocabulary being understood. There's some important also ways to help in your communication. If you're asking questions, you want to try to avoid open-ended questions. It's better to have yes or no questions for that person. So don't say, what would you like for breakfast, which can cause frustration on the part of someone who can't find the words to express it. But you could say, it's breakfast time. Would you like eggs? Would you like oatmeal? And that's going to be easier, because the yes or no is the answer the person cannot come up with, or eggs or oatmeal is easier than trying to think of what they actually want. It can help to give multiple cues. So more than just using words, you can use visual cues and gestures. You can point to something to help understand that this is what we're talking about. Try to avoid making sudden gestures that are going to startle the person, but it can help to gesture. And it can help to write things down. So any kind of mnemonic device is good to try and use. You can use reminder notes, you can have calendars, you can have labels, you can have lists, you can put names of people on the backs of photographs, so that when someone looks at a photograph, they can look at the back and remind themselves of who it is they're looking for. Again, we talked about making your questions easier to answer by sort of embedding the answer in the question. So, not what do you want for lunch, but I'm making sandwiches for lunch. Would you like ham or turkey? And if they still feel like it doesn't seem like they can answer, then you can say, how about ham? And those yes or no questions are going to be a lot easier to answer than open-ended ones. Anything else? We can, if you have reminders in place, that's fine. You still will probably need to find yourself repeating information. Again, we said that this is one of the most common behavioral communication behaviors in the middle stage of the disease. You can try and turn negatives into positives if that's going to help get the right outcome for the interaction. So instead of saying it's time for your shower, you can say, let's go get you cleaned up so that you'll be ready for Cindy's visit this afternoon. Try and make a positive outcome associated with the activity that needs to happen, and try to avoid quizzing the person. So if they really are having trouble remembering something, if they can't understand what you're saying, it's not something that they can try harder and do better and do. It's not their fault, and quizzing them is going to just lead to frustration. Some other thoughts: just respond empathetically, reassure the person that you're there and that you're listening, you hear their concerns. Keep in mind that the facts of the situation are much less important than the person's feelings and their view of reality. Whatever they see or feel or believe is very real to them, even though it may not match your reality. And so if you can respond to the feelings of fear, frustration, anger first, then that can help you avoid resistance in a situation where you have different realities that you're perceiving. Just continue to provide reassurance that you're there together and safe, that you're there to help. Let them know that you hear and understand their thoughts. And if there's not a safety issue, go ahead and agree with what they're saying and go along with the flow. Find common ground wherever you can, and make any adjustments to the physical situation that are necessary, but then try and redirect that person to another activity if needed. And again, we go over this whole approach in much more detail with a framework in understanding and responding to dementia-related behavior. So that's our section on the middle stage of the disease. We'll move on to the late stage now, which is also called the severe stage. And in this late stage of the disease, the person may only use a few words. They may not talk at all, but they still need to connect and to communicate. And this person will have lost a lot of the functions by this late stage of the disease. For caregivers, it may feel very frustrating, like you really want to do something to help, but usually it's more about your presence and your connection with that person than anything specifically you could be doing to help them. Keep in mind that even though the language ability may not be there at all, or it'll be severely impaired, that person is still an adult with a sense of self that continues throughout the course of the disease. And you can connect with that person's sense of self. You can honor them by remembering their history and trying to provide, the things that their preferences. So you want to help them feel content whenever possible. So you can do that by, remembering what's their favorite music, different things like that, and try and make their physical environment reflect what their preferences are. And even if they can't respond, keep talking. Use familiar words and names. You can say poems or passages or songs that they know. And whether or not you get a direct response from them, the sound of your voice is going to help maintain that connection between you. In fact, in this part of the disease, we really learn to use all 5 of our senses to communicate. So touch, sight, sound, smell, and taste. This is going to help you stay connected to that person in the late stage. Okay, in this video, Sandra talks about talks about connecting with her mother in the late stage of the disease.
I know that my mom feels aggravated. I know that she feels alone. I know that she feels confused. And I know on any given day, I don't know if I've made it better for her. I try. In these later stages, I've come to recognize that being really aware of the 5 senses is really important. Touch seems to give her a great deal of comfort. I know when I come over, I'm going to brush her hair all the time. And my husband noted to me recently, he said, you should see the look on your mom's face when you're brushing her hair. She's just happy. She's just happy. She doesn't say a lot. And I do it for a long period of time. I comb it, I braid it, I do funny things with it, but it just allows me to just be with her in a way that makes her feel comfortable.
So I find this really touching, listening to Sandra, and I think it gives a good kind of window or understanding to what the late stage, caring for someone in the late stage of the disease can look like. So if we go back to thinking about our 5 senses, you can use your creativity to try and think about connecting through touch. It is important, however, if you are touching someone, that you want to be mindful of a couple of things. Their skin may be very delicate and prone to tearing. You want to make sure it's a gentle touch, whatever you're doing. The same goes for bones, that may break easily, and just flesh that may bruise easily. Just try and keep your touch gentle. Similarly, if you want to use, say, a lotion hand massage, as they're suggesting there, look for something that isn't going to cause any kind of reaction with the skin. Just something to keep in mind. When we talk about connecting through sight, I had mentioned before that there's going to be a loss of peripheral vision. So keep that in mind, that you're really going to be looking at something right in front of the person. There tends to be a loss of ability to distinguish subtle differences in texture or tone. So something bright and more contrasting is going to have a better chance of being perceived correctly by the person. An example of this is if someone is sitting down to eat a meal, try to have a contrasting color between the plate that the food is going on and the placemat that's underneath it. And that way the person has a chance of understanding, I see this round plate on this rectangular mat, and I can identify that this is now the time to eat. It's going to help in interpreting what's happening around them. So connecting through sound, if music is one of the emotional connections that people retain the longest throughout the course of the disease. And it's really pretty amazing how the right music can elicit a response from someone who appears otherwise unresponsive. If you've never seen the documentary called Alive Inside, I highly recommend that you watch it, and you'll see some very dramatic situations where someone appears very, very unresponsive, but you bring that happy music from their youth and they really do come alive. I've seen other similar documentaries that where, you know, a ballet dancer will respond to music and get up and dance, and it's pretty amazing. And so that's just something to keep in mind. And it's great to read books, poetry, anything that's familiar to the person. You may not get a response. Sometimes but it's really about the sound of your voice and continuing to make that emotional connection through sound. Communicating through smell. Smell, probably everybody's experienced this, is one of a very strong, you know, our olfactory senses can trigger very strong memories and emotions. And so that remains true for people in the late stage of the disease. In general, as people get older, their sense of smell diminishes. And so it may take a stronger smell for somebody to react to it. The flip side of that is you want to make sure that you're not going to use something that's too pungent or powerful, that it's going to cause, you know, some kind of a negative or adverse reaction. So just bear that in mind. A fragrant lotion for a hand massage, you want to make sure it's not going to trigger a skin reaction. You want to make sure that some kind of sharp, pungent smell isn't going to trigger some other adverse reaction in the person. And food falls into this category. The smell of food cooking is something that can be enjoyed by someone even into the late stages of the disease. Similarly, taste is something that people can continue to enjoy through the late stages of the disease, just to trigger those memories. Taste and smell, as we know, are intimately connected. But very, very important to keep in mind, particularly in the late stage with some of the loss of function that can very often include a loss of ability to swallow or a diminished ability to swallow. So sometimes people wind up on diets that are liquid or soft foods, and you just want to make sure that whatever you are preparing or giving someone to eat and enjoy is something that they're going to be able to eat safely without choking on it. Okay, so that was the late stage of the disease. So to summarize, you know, maximizing our communication is trying to maximize our connectedness with the person living with dementia. And that's going to involve adhering to a few principles. Try to understand what is and isn't possible to change. And you can do that by understanding everything you can about the disease. And one way to do that is to stay up to date with the latest information on the scientific breakthroughs, to have an understanding of the progression of the disease through presentations like this. There's a lot of information that's available through the Alzheimer's Association, and we'll give you some ways to connect with the Alzheimer's Association. In fact, I think you can see them, if you can see the background of my screen, I think we probably put it in the chat too. The Alzheimer's website, alz.org, has a wealth of information that can help you get educated and to stay up to date on the latest understanding of the disease. And knowing and accepting the functional and cognitive limitations of the person with the disease is going to help you to be a better caregiver. So remember again that person is an adult with a sense of self. This should always be respected, even if they're not able to communicate using words in the way that they used to. So then you're going to use your feelings to connect with that person. And you can do that throughout the course of the disease. You convey your mood through your actions and your tone of voice, not just your words. And the person is going to pick up on those feelings and reflect them back to you. So try to stay focused on your positive feelings for that person to increase your understanding of their reality. Demonstrate your caring to help you connect with them. Listen, observe, try to decode what the other person is communicating about their needs and wants. That can be very hard to do, but if you're someone has a deep and long understanding of this person through, your relationship with them, then that can help you try to decode what's happening. And when you join their reality, you have a better chance of understanding what they need and how best to intervene. So communicating throughout the course of the disease requires commitment. You have to adapt to the changes that are taking place. It is a progressive disease. But when you do learn to adjust your own communication as the disease progresses, you can learn to connect deeply with that person and maintain that connection. So that's kind of a summary of what we talked about. And we went through the 3 different stages: early, middle, and late stages of the disease. Before we move on, we're going to take a minute in our next video to address a really important issue, and that is care for the caregiver. It's very critical. And as a caregiver, you might overlook it, but I just want you to understand that it's very important as part of whatever care planning takes place for the person with the disease, that there's also a care plan for the caregiver. We're going to hear Dr. Sam Fazio of the Alzheimer's Association Home Office describe the multiple effects of not caring for yourself as a caregiver.
Taking care of yourself while you care for somebody with the disease not only impacts your own health, but it really can impact the person with the disease. So for example, if you're not getting enough sleep, you might be easily irritated, which will then sort of spill over to your interactions with the person with the disease and maybe being short with them, which then might cause them to get frustrated. So it's not only important to take care of yourself for your own health, but really for you to really be a good caregiver.
Okay, so on that note, that wraps up our presentation. Here are some of the resources I mentioned. There's a 24/7 hotline. If you're feeling overwhelmed, if you don't know where to start, if you go to the website and there's basically, too much information there for you to sift through, know that there is a 24/7 helpline, 1-800-272-3900, that is staffed 24/7, 365 days a year by an experienced clinician who will be able to either give you a direct answer or connect you with the resources that you need. And you can really call that number with any question you have. So if you're feeling like you don't know where to start, or if you have a specific situation that you want some help and support for, this is a great number to keep in mind. So I think we put it in the chat. Hopefully we can do that. Maybe we can do that again. But at this point, if there are any questions, I would be happy to take them.
Well, thank you, Ariana.
Thank you. This is great. We
Yeah.
do have some questions.
Great.
First off, Ariana, here's a comment by someone. And look, all of our questions are totally anonymous, remember. Okay. She says, my mom has dementia. Her sentences are like word soup. Is she struggling with expressing her thoughts or having coherent thoughts? Is the source of the outpouring of the sentence?
So the question is, if her mom, so is this a question of, is her mom simply having trouble expressing herself, or is she having trouble understanding as well? So both things happen as the disease progresses, the ability to communicate, but also the ability to decode what is being said to the person. Also, the disease is different for everyone. So I can't comment specifically on your mom, but some combination thereof is certainly possible and likely. It's a little bit hard to say. I don't think it should stop you from talking to her, because again, as we mentioned, the emotional connection of hearing your voice and together with a kind of patient tone of voice and a positive attitude is going to help you, even if the actual words or the content of what you're saying are not something that she can decode.
Good. Joanne, do you have any questions?
Gary, I had some questions that had come in. I can go over here. One of them is what percentage of older adults develop Alzheimer's?
Oh.
Boy.
So Alzheimer's or other dementias are diseases, and they are progressive diseases that affect the brain. It's not a normal part of aging to develop Alzheimer's. The percentage of people that develop Alzheimer's is, so amongst people who wind up with a diagnosis of dementia, about 2/3 of them are Alzheimer's. The other third are different kinds of dementia. They do present clinically in a similar fashion. That's why when we do this presentation, we talk about Alzheimer's and other forms of dementia. So the communication changes that you see are very similar, even if the actual pathology inside the brain, the actual proteins that are getting tangled up are different. So I apologize, I don't know the latest sort of statistic for the percentage of people that develop dementia versus don't. It can be a little bit murky because not everybody gets diagnosed, or sometimes people get diagnosed and they don't get told about it, which is another issue and another problem that we have in our health system today. But you're not predestined to developing dementia. There's a lot of science around developing healthy lifestyle approaches that correlate with a healthier brain function later in life, and they're working on treatments, therapeutics that are making better and better progress toward having an actual impact on the disease.
All right.
We have another one. Actually, I have quite a few that have come in.
Yeah.
If someone is diagnosed with mild cognitive impairment, is that considered the early stage of disease?
Mild cognitive impairment does not always develop into full-blown dementia. So it can be considered an early stage of the disease, but it is not a guarantee that you will develop the actual disease. Some people are diagnosed with MCI and they stay there through the end of life without any further decline.
Okay, another one, typically how many years at each stage and how quickly does it progress? And I suspect that's a very great question.
It's definitely not one that we can give a hard and fast answer to. So we do say everyone is different, and that's true. So, you know, like someone can have MCI and never develop full-blown dementia. Earlier onset tends to be correlated with a faster decline. But other than that, we can't really speak except in very, very broad terms. It's different for everyone.
Mhm. Okay. And is a person struggling with dementia less capable of expressing pain within their body, or would they be more likely to just act out with the pain rather than expressing it?
Well, acting out is actually a form of expression, and that's kind of how we characterize the middle stage of the disease. So the way to think about it is that with the diagnosis is going to be a continual and gradual loss of ability to communicate through words. And so if someone is acting out, it could be their way of trying to express that they're experiencing pain. It could be that they don't have the words to say it. I mean, that definitely is exactly what we're talking about in the middle stage of the disease when we talk about dementia-related behavior. Again, I would say if this is a specific question for this person as a caregiver, then very much consider attending the understanding and responding to dementia-related behavior, because that's going to help you understand that there can be a lot of different causes for a particular behavior, and that you need to be a little bit methodical if you go in and try and decode what the cause of it is.
Good. I have a question here. You mentioned frustration and communication often in the presentation, but you didn't talk about anger. How does anger come into the conversation, and how does the caregiver deal with it? Because I know it's very common.
Yeah, so certainly anger, I think that they're referring to anger on the part of the person with the disease. Is that how you understand the
Yes.
difference? So frustration, anger, I mean, there's a continuum, right, of emotion in any situation. Frustration can lead to anger. So I'm not really sure how to answer that question more specifically, but yes, certainly a heightened sense of frustration can become anger, which is why we really try to talk about the ways to communicate that are going to be the most helpful and the least likely to lead to escalation. For example, outright anger, which can also take the form of, verbal or physical aggression. So.
Okay. It's very frustrating for the caregiver sometimes.
Yes.
Sure.
Okay. I have
Go
a
ahead.
question if it's okay to, I think we're hitting 12 o'clock right here, but if we're okay to keep going on. Someone who had articulated some experiences that they had, but she did recognize that it was really her that was triggering Sundowner. And she would walk out of the room, calm herself, and come back in, and then just start all over again. And that was very helpful. But I think her question is how is it with other people that might be coming into the situation and then triggering Sundowner, even though the person that's the caregiver knows how to deal with it, but dealing with someone who doesn't really know how to deal with it, and then that triggers Sundowner that the caregiver ends up having to deal with.
Right. So now we start getting into some of the real complexities, and part of the reason why caregiving is so hard. this person sounds like a really amazing caregiver to be so aware and able to identify that they themselves were a trigger, that other people could be triggers. It can be hard to even figure out what the trigger is in any given situation, because everyone's a little bit different. And if you are the caregiver, the more you understand the situation, the more you can learn to identify what might be possible triggers. You just need to factor that into the way that you structure, the life of you and the person with the diagnosis, in order to minimize those triggers. Again, this is something that we talk about a lot in understanding and responding dementia related behavior. Is there's a whole kind of detective work that goes into determining what a trigger could have been for behavior. And then there's a whole post facto analysis of how you respond to a particular situation to try and figure out what did and what didn't work. What do you want to do next time? What do you want to change? And so again, that's all part of the framework that we go over in that presentation.
Good. Thank you, Ariana. This is amazing. I will say to everybody that the video of this situation, this program, will be posted on the ESCOM website, which is escom.marin.edu. Give us about a week and we usually put it up by then. So it is available to everyone.
Yes, I'd also like to let you know that that you had provided a couple of documents, Ariana. Thank you. And I actually put them in the chat. If you have capability, I think you can download those from the chat. But if not, maybe we can send them out also when we send out the link. Because I think they're really good documents on kind of summarizing what you talked about and communicating. And
that would be good. We'll try to send them out to participants here.
Yeah, the documents then, hopefully these are all there. We will send an actual copy of this slide presentation. We have a brochure called Compassionate Do's and Don'ts that can help give guidelines on what are more effective ways of trying to communicate through the course of the disease. We do and also have an Alzheimer's brochure on communication that is included in there. A specific tip sheet around sundowning. So for anyone who's encountering that particular behavior, we didn't discuss it specifically, but obviously people watching know what it is. It's just a tendency for certain agitation to increase in the late afternoon, early evening hours, and it happens enough that we give it a name. We call it sundowning. And then we have just some basic information on some of the programs and services that are available through the Alzheimer's Association. It can be quick for, I don't know, some helpful information to become too much information to absorb. So again, if you're feeling overwhelmed by, you don't know where to start, if anything I said today was not satisfactory answer, feel free to give that 800 number a call. That's what it's there for. And get the help and the information that you need.
very good point, and thank you for that. And there are a couple more questions that came in kind of related to that. Is how do you deal with someone who is in complete denial of the disease? And I imagine there's probably resources to help with that. And so there's another gentleman that has his father lives out of state and lives independently, and he's just wondering how he can help deal with that. And so it's there's probably a lot of information out there, and like you say, more than you can handle. But
I'm afraid it's a bit. We have to close out here pretty soon. Joanne, do you have any closing comments?
No, can you hear me?
yes.
Yes.
Okay. I do know. I just would really like to thank Ariana. I thought you did a fabulous presentation, and with real grace and knowledge. And I think it was very helpful to everyone. Thank you so much for presenting this for us. And I think you gave people the avenue to discover how much help they can get from the Alzheimer's Association. So thank you.
And
Yes.
thank you.
It was wonderful, Ariana. Thank you so much. And thank you for Joanne for hosting this presentation.
Yes.
I do want to thank the attendees for coming on board with the presentation. I hope you can take away some help and some advice from this talk that will make your lives easier. We've recorded it, and as I say, we'll post it by the end of the week. I do have some interesting programs that we have lined up for the future. For instance, in February, the College of Marin Sociology professor, Walt Turner, will present for Black History Month. All right. In March and April, we have two current authors presenting to us their works in person on the Kentfield campus. And stay tuned, we'll send out the announcements. In October, we're celebrating our 50th anniversary. It'll be a big party by ESCOM for ESCOM, and it will be at the new, beautiful Jonas Center on the IVC campus in Novato. So mark your calendar for October the 14th. We will let you know very soon what's going on. Thank you again for joining us in these programs. They're very important to us to be able to present them to you, and the speakers, we try to pick the best to give you the best up-to-date information. Thank you. Stay healthy and active.
Thank you.
All right. Thank you.
Very good. Bye to all.
Thank you.